Medicare. What is Medicare? All right. A lot of people say, okay, what's Medicare? Medicare has parts to it. Part A, which is in these sheets. Part B, Part C, Part D. All right. Part A is hospitalization. That's an entitlement when you turn 65. Okay. You automatically get that. Part B, which is doctors, essentially, you pay for. If you are if you make under $103,000 a year, your Part B payment, at least up to right now, is $174.70. We do not know what next year will be. Probably the first or second week in November, we'll know. The government will make the decision with Social Security, increased payments, and what your Part B of Medicare will be. And then it goes up exponentially based on your adjusted gross income, up to $500-600 a month for your Part B. Part C is Medicare Advantage. We sell about 75-80% of our business is Medicare Advantage. What is Medicare Advantage? Medicare Advantage is managed care. It includes networks, basically PPO networks, national PPO networks, local PPO networks. It includes ancillary benefits like gym membership, some dental, some hearing, vision benefits, and of course prescription drugs built into the plans. That's basically Part C. And Part D is standalone prescription drugs. Now, you all have probably read what's going on in the Medicare world right now and into 2025. Because of the Inflation Reduction Act, and you gentlemen in the market, in banking and mortgages know what the Inflation Reduction Act is. Basically, it says we're going to cap prescription drugs at $2,000. Well, once you pay $2,000 out of pocket for your prescription drugs for the calendar year of 2025, everything is covered 100%. It is a lot different from 2024 and 2023, etc., where you had the deductible, you had the copay, you had the what do you call it, donut hole, and the donut hole was between $5,300 and $8,000 in there. In that vein, you pay 25% of the cost of the medications, and then after $8,000, it became catastrophic, and you paid $5 to $10 for medication. Well, Inflation Reduction Act came in, that's all gone. Now it's $2,000. But here's what they did: because the insurance companies are not making as much money as they have made previously, they've all increased their premiums. They've changed their formularies around. So I suggest anybody that's on Medicare, please check your formularies, check your annual notice of changes, and see what is in those annual notice of change and what your premiums will be. I know for a fact, and Bob and I have discussed this, in the state of New York, one particular company that's called WellCare, they went from $10 to $35.
$370 a month to $38.70.
$38.70. That's outrageous. And probably they cut back on the medications that they've cut in the formulary, or they've tiered up the formulary, which is going to cost you more. Crazy as it may seem, but this is the way it is. And in the last couple of days, and we were just talking about that before the meeting, Humana and Aetna are laying people off because they're all top heavy and they can't afford all this because they got to pay more money out of their pocket. In their bottom line, and their stockholders, they got to make sure everything works. So please, 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 anybody that you know that is on Medicare or is going into Medicare, you got to have a professional talk to you about what's happening with them for 2025. Okay, most important, because you don't want to be at January 5th and you go to the drugstore with your card and you tell the pharmacist, okay, this is what I need, here's my card, and they tell you you're not covered. It invariably happens every year. People ignore the phone calls from us people. They know they say, I'm covered, everything's fine, I don't need any help. Well, it happens every year, January 5th. I tell my wife, and I've always joked about this, January 5th is the busiest day of the year because the phone rings off the hook. People don't know. Tony, I'm telling you now, okay? Right? And I told you this morning, don't be in that spot with people in January 5th. Please, please. You know, we like to work, we like to make money, but we're here to help our clients. And that's the key thing. We want to help our clients. we've done enough in this business, and I say that financially, they're not worried about the financial end anymore. We're here to help people, and that's the key thing. We tell everybody, if you have an issue, don't call the insurance company and stay on the phone for 2 hours. Call us. We know where the bodies are buried and how to get the people and get an answer for you much quicker, much quicker. It's very true. I know you all laugh, but it's very true. And more than one, and there are many of our clients that say, you're the only ones who can help us. You're sincere. You know, you're on top of things. We have people from year to year that come back to us and say, I would only use you and your wife to do this because you're always on top of it. You call us back. Now, we all know in any type of business, the worst thing is people make a sale and never pay attention to their clients. They're the people they sold. We take everybody. All right. The last few days since 1st of October, the phone has been ringing off the hook, and I'm telling you, literally from 8 o'clock in the morning till 8 o'clock at night about all these changes that's going on in the Medicare world. So please, everybody, stay on top of that stuff because your friends, your relatives, your aunts, your uncles, they need to be advised. Okay, what do you got?
I just have a quick question.
Go ahead.
When you turn 65
Yes.
and you're entitled to Medicare A,
Yes.
how is that communicated to you?
Okay. One of two ways. If you're collecting Social Security already, you will automatically get a card in the mail, or automatically for the A only. But if you want B, you've got to go on socialsecurity.gov anywhere about 3 months before you're turning 65 and sign up for both, A and B. Now, if you're still working and you have health insurance through your job, you still have to sign up for Part A. Don't let it go by. It's an entitlement because it's be shared with your health insurance plan. It depends on the size of your company. Oh, which is another thing. If your company has less than 20 employees, okay, you have to get A and B. All right. One of those crazy quirks. There's a quirk that I just learned about in the last 2 months about COBRA, which is really weird. A situation with Medicare, and I never knew it, and because everybody talked about it in a different way, but that's too long and involved to go over. But yes, John.
If Part B is covered for doctors and Part C covers prescriptions,
No,
what's
part,
left?
all right. What's left?
Part
Okay.
A that covers?
Part A is hospitalization. Okay. All right. Part B is doctors. Part C is Medicare Advantage, which takes in Part A and Part B. Okay. You have to have Part A and Part B to get Part C. Okay. And then Part D is in David or dog, right? That's standalone prescription drug coverage. 95% of the Medicare Advantage plans have prescription drugs built in, so you don't have to go buy a plan separately. Now, why do people buy standalone prescription drug plans? Because they buy Medicare supplement plans, and that's a whole different thing. Medicare supplement plans supplement the 80% that Medicare doesn't cover. It's run by an insurance company. You pay a premium every month for that. And Bob, am I correct? 9 to 11% it's going up in New York State for next year.
Yeah, I think the plan that I have is going to go from 242 to 270.
Yeah. Okay. State of New York is community rated. Everybody pays a flat rate. It's guaranteed issue on supplements. You can go from one plan to the other, plan G to plan N, etc. In New Jersey, for instance, and many other states, it's medically underwritten unless you first go in when you turn 65. It's guaranteed
One
issue.
more question.
Okay, Ellie.
Well, this is really a testimonial. Bruce really knows his stuff because I asked him yesterday, if I was still okay, because he's reviewed my plans before, and he said, well, and I reminded him that my prescription plan is an AARP through Walgreens, and he said, well, we have to talk because Walgreens is going to be out of the picture soon. So I wouldn't have known that, but he knew it. And so we're going to be able to sit down and reconfigure my prescription drug situation.
Yes.
So I would recommend that everybody let Bruce, review your coverage if you're already on Medicare.
Yes.
He'll tell you if you're on the right plan.
Yeah.
I have a problem with the word entitlement. If somebody worked for 45 years, that's not an entitlement.
It is.
An
Well,
entitlement
well,
somebody
You-
It's in the
all right.
country, gets free stuff.
No.
That's an entitlement.
Okay, with Medicare, we're not talking health insurance, we're not talking, going to the hospital, walking into the door and go with the emergency room. All right. Medicare says you have to have worked 10 years or 40 quarters in order to be entitled for Medicare. All right? Part A, you don't pay for it. So everybody, the wording is an entitlement. That's how they put it in the book. It's entitlement.
Right.
Part B, you have to go for. Now, I'm just going to back up a second. If you want A and B, and it's 3 months, 4 months before your birthday, because everything starts on the first of the month, you sign up, go online, socialsecurity.gov, and you sign up for Medicare A and B. Okay? All right? So, yes, Aviva, my dear.
I like this one. Can I be 65, work, and on Medicare?
Yes, you certainly can. Yes. If your company has less than 20 employees, you have to get A and B. Okay, you've turned 65. If your company has more than 20 employees, it's your option to stay in the health plan at work or go on to purchase B and get a full Medicare Advantage plan, Medicare Supplement plan. You have to weigh the cost factors. How much you're paying weekly into your plan at work, if your spouse is with you on the plan, etc. You have to weigh all these things, and we do all these numbers for you.